How do you do, ladies and gentlemen? My name is Grant-Whyte. I'm a former graduate of Cambridge University Medical School and a diplomat of the American Board of Family Practice. With me today is KK, a former patient and also a breast cancer survivor. Welcome, KK.
Thank you.
KK, I'd like to sort of ramble a bit and tell you about breast self-examination. Years and years ago, this was the in thing. Women were taught to examine themselves once a month, not more often, and do it properly. However, in the latter 80s, a series of flawed trial results coming from Shanghai, China, and St. Petersburg, Russia, 260 women factory workers and 120 women factory workers from St. Petersburg. They produced some very flawed results, and then breast self-examination got a bad rap. Anyway, I am here today to tell you that breast self-examination, I'm not just talking to women out there, but doctors too, is a lifesaver. The vast majority of women in North America, Europe and Asia do not examine themselves. They don't do breast self-examinations, and those that do not do it correctly. The other point about it is that the doctors today, particularly with a 10-minute office visit, many women realize that their clinical breast examination is really far from adequate, and hence breast cancers can be missed. Now, I think, having said all that, I'm a great believer, and I've taught extensively how to do breast self-examination. I call it breast braille, because what you're doing is using the pads, these incredible sensors of the middle three fingers, to find occult lumps. Now, finding lumps is not easy, promise me. Even the most excellent doctor can miss lumps large and small, but you're going to miss more lumps and jeopardize women's lives by missing them. This is what was said in the latter part of the 5th century BC by Socrates. First doctor, do no harm. And this remains as true today as it was then. So listen, I want to show you, KK, how you should really be examining yourself. This is basically the palpation element of the breast self-examination. Of course, the woman will stand in front of a mirror, not a fogged up mirror in a bathroom, but a clean mirror, and she's got to look at both breasts. Is there any asymmetry? Is there an inverted nipple? Is there a thing called peau d'orange, which is an orange peel-like puckering of the skin? Are there discharges? And then the woman must lie down. Why must she lie down? Because when she lies down, the breast tissue is spread more evenly over the chest wall, and palpation becomes easier. Now, the palpation is recommended by the American Cancer Society, and many people don't seem to appreciate this incredible way of discovering lumps. First of all, the correct way of doing breast self-examination is with your fingers, 3 middle fingers, flat. You're going to use the pads of your 3 middle fingers to examine the breast. There's a 3-pressure protocol here. The first pressure, and you've got to examine the whole breast, light pressure, and then you go for the tissues in the middle part of the breast, firmer pressure, firmer pressure, firmer pressure. I've just found a lump. And then you go for the breast tissue on the anterior chest wall, and that's fairly firm. There's another lump there, damn it. And okay. And then we are compressing the breast tissue against the tissue. There's one right there, which you wouldn't have felt if you were just Mickey Mousing it. This is a woman's life we're talking about. People's lives are very much at stake, women's lives, and doctors and women patients must realize that they must take some of the responsibility into their own hands. Now, I want to show you how the magic proprioceptive sensors of the pads of the middle 3 fingers work. Now, KK, close your eyes, give me both hands, and I'm putting a coin in each, and I want you to see if they're the same or they're different, or what do you think they are now, okay? What are they, for starters?
They're coins.
Yeah, what coin? You've been using it every day.
Oh my goodness, I couldn't tell you. But I do think they're different sizes. And this one has a larger rise to the
Okay, well, keep your eyes closed. Give me those coins.
Okay.
And I want you to take that one in one hand and this one in the other hand.
Oh,
Now, is there a difference?
yeah, big difference. This one's a lot larger, and they both have a rough exterior, but this one is rougher, and this one has a larger face or something on it. I can't
You're
tell.
quite right. Now look at these coins. They are South African coins. No wonder you didn't recognize them. And one is obviously larger than the other, but you could tell the texture of these coins, you know. So in January, you examining yourself. In February, my golly, this thing is bigger. And that goes from your fingertips to the memory bank in your brain and registered. You mustn't do these breast self-examinations more than once a month. If you do, you're running into all sorts of trouble. 1 month apart is all that is necessary. And remember, you must examine up into the axilla, and that's where you found your lump.
That's right.
Thank you.